This in-service video provides basic instructions for use of Teleflex's MiniLap Percutaneous surgical system with MiniGrip handle, intended for use in laparoscopic procedures for mobilization and manipulation of tissue. Always refer to the instructions for use packaged with the product for complete instructions, warnings, indications, contraindications, and precautions. MiniGrip graspers are single-use devices which are shipped sterile and should be properly discarded after use. Do not reprocess or re-sterilize. The surgeon-designed MiniGrip graspers are 2.4 millimeter instruments with a built-in insertion needle that allows for percutaneous insertion through the skin, without the need for additional trocars, leaving a minimal scar. Caution: the unit is packaged in the unarmed position where the needle tip is shielded. The needle tip must be exposed prior to insertion. To arm the device, ensure that the ratchet switch is in the off position. Then push up and hold the black arming button. Squeeze the trigger fully. Then release the black arming button. Gently release the fingers holding the trigger. The trigger should remain in place. Note: the red arming indicator will appear behind the trigger when the needle tip is properly exposed. Using a number 11 blade, create a small 1 millimeter stab incision at the point of insertion. Under direct visualization, introduce the needle tip through the skin by firmly grasping the shaft. Slowly advance the MiniGrip instrument into the intra-abdominal space. When the needle tip is observed in the surgical space, lightly squeeze the trigger. Then push the arming button up and slowly release the trigger to advance to the fully open position. Release the arming button. The arming indicator should no longer be visible. To place the unit in the ratchet mode, turn the ratchet switch up to the on position. To take the unit out of ratchet mode, turn the ratchet to the off position. Squeeze back on the trigger to release the handle. Now you have a working device. Position the open jaws over the target tissue and squeeze the handle until the tissue is approximated. The instrument is equipped with a rotation feature to aid in the placement of tissue into the jaws. If required, turn the rotation hub to align the jaws onto the tissue. To remove the instrument, switch the instrument into the ratchet on mode. Ensure there is no tissue present in the jaws. Squeeze the trigger fully until the jaws are locked in place. Then carefully remove the instrument from the surgical site. If reinsertion is needed, repeat the prior arming and insertion process. Safely dispose of the instrument following all facility regulations after use. This has been an in-service video to provide the basic instructions for use of Teleflex's MiniLap Percutaneous surgical system with MiniGrip handle.